in.
Hi,
Hey.
my name is Kathleen. I'm the pharmacist here. How are you?
All right. I'm honestly a little confused about why you wanted to see me. I have another appointment after this, and I did go over this with my doctor.
Oh, okay. I'll try to get you out quick then. I just wanted to go over some important pieces of information about the medication. I know you're picking up a new one. It should take no more than 10 minutes.
Okay.
Is that okay?
Sure.
All right. So I'm going to verify some information real quick. Can you tell me your name?
Carissa Dugga,
Okay. And your date of birth?
March 29th, 1959,
Address?
320 The Fenway in Boston.
Okay. And what medication allergies you have?
I'm allergic to sulfa drugs.
Okay. And what's your current medical diagnosis?
I have a sleep disorder, and I have problems with my sugars.
Okay. And what other prescription medications are you on?
Just the ones I'm picking up.
Okay. Any herbal supplements, vitamins, over-the-counter medications?
I take Allegra D for allergies.
Okay, got it. So I'm going to start with your new prescription, which is the azithromycin. Have you ever taken this before?
No.
Okay. So this is what it looks like.
Okay.
And what did your practitioner tell you this is for?
For my sinus infection.
Okay. So yep, it's going to treat your sinus infection, should clear it up pretty quickly. How did your practitioner tell you to take it?
To take 2 pills every day.
Okay. So it's a 250 milligram dose. You're going to take 2 pills on the first day as a loading dose, and then for the next 4 days, since it's a 5-day treatment, you'll just take 1 for the remaining 4 days.
Okay.
So 2 pills on the first day, and then 1 pill every day thereafter till you finish.
Okay.
And no refills on that, since it should clear the infection right up. What did your practitioner tell you to expect?
She didn't mention anything.
Okay. And in addition, we want you to store this in a cool, dry place away from heat, light, or moisture. And if you miss any doses, you'll want to take it as soon as you remember. But if it's more than halfway to your next dose, just wait until then to take the next dose.
Okay.
But in regards to the side effects, so the azithromycin can cause diarrhea. That is common with patients. However, if it gets to be severe, you'll want to give your doctor a call right away.
Okay.
And don't take any medications to treat the diarrhea until after you've spoken with your practitioner.
Okay.
But other than that, side effects, some dizziness, nausea, signs of an allergic reaction. So that would include like itching on your skin or swelling or tingling in your throat. You'll want to give your doctor a call right away.
Okay.
So to make sure I covered everything, how are you going to take this medication?
2 pills the first day, 1 pill a day after that.
Perfect. And what other questions do you have for me?
I mean, I just don't like taking medication in general, and my doctor said I should feel better soon, so can I just stop taking it when I feel better?
So unfortunately with these medications, antibiotics, even after you start to feel better, you want to finish the entire course of treatment. And that's because if you stop too early, you might still have some lingering bacteria in there, and then they'll be resistant to this medication. So that's why it's important that you complete the entire dose, even after you start to feel better, just to make sure that any lingering bacteria in your sinuses is fully cleared.
Okay.
Does that make sense? Okay. Any other questions?
No.
Okay. And of course, if you think of anything else, just give our pharmacy a call or your doctor. Now with the metformin, what are you taking this medication for?
For my sleep disorder, I have trouble falling asleep.
Okay. The metformin is actually, it's for your sugars. It's to treat your diabetes.
That one. Okay.
Looks like this. And how have you been taking the metformin?
That one I'm supposed to take 1 tablet a day.
Okay. How have you been taking it?
I'm honestly just picking it up because my daughter wants me to. The good Lord will take care of me. If it's my time to go, it's my time to go. And I really hate the idea of being dependent on a medication every day for the rest of my life.
That's understandable. So what I'm hearing is there sometimes where maybe you don't take it or you forget to take it? Or it's because you don't want to?
Yeah, I just don't want to.
Don't want to, okay. So that's understandable. It can be daunting to be put on a medication that you're told you're going to be on for the rest of your life. But it sounds like your daughter really cares about you being around, so she wants to keep you around. with this medication, it helps manage your diabetes, and diabetes is a serious condition that if it goes untreated without medication management, you can have a slew of other serious conditions, heart disease, stroke, death, because the diabetes is untreated. So this is a medication that helps manage it. However, there are other options. So diet and lifestyle changes are a big part of managing diabetes. If you don't want to be on this medication permanently, would you be open to maybe looking into dietary or lifestyle changes that could maybe work for you?
Sure.
Okay, great. So what I'm going to do, since you're interested, I'm going to call a dietitian later today, and then I'll give you a call back, and that's to set up an appointment so that you can discuss maybe some potential diet or lifestyle changes that could help you reduce your need for this and maybe eventually get you off of it. Does that sound helpful? Yeah. Okay, great. Because again, until we work out those changes with that dietitian, I want you to stay taking this medication daily as prescribed, because it is really important to manage the diabetes. If left untreated, you can have much more serious problems with it, because it is a serious condition. But what's a good time for me to call you to set you up with an appointment for the dietitian to get back to you?
Tomorrow morning, I guess.
Tomorrow morning? Okay, great. So I'll reach out to them today, and then I'll give you a call tomorrow morning to put you in contact with somebody who'd be available. Okay. And so where did we leave off? What problems have you been having with the metformin?
Nothing. So if I change my diet and exercise, I can get off of this?
So that's something that we'll have to discuss with the dietitian and probably your practitioner too. But depending on what those changes are and how significant they are, so how willing you are to make significant changes, what they would look like, depending on the details of your condition, it would reduce your need, and there's potential for you to get off the medication. Until we talk to those other people, I'm not exactly sure. But there is potential, and there's hope. Okay. What other problems, though? No problems so far? Okay. Yeah, again with this one, just if you have any stomach pain, nausea, vomiting, those are normal. If they become severe, just give your doctor a call.
Okay.
And I believe that's it. Any other questions for me?
Not that I can think of.
Okay, great. Well, you know how to get in contact with us if anything does come up. But otherwise, you can rush off to your appointment. I know you're